God's blessing, I am very happy that we were able to make it here today to have this hearing. We are dealing with some difficult times in the territory, and I hope as we continue to persevere, at some point we'll just be okay. I'll be okay with that. But starting off with this specific questions I want to ask, could somebody give me any numbers as it relates to the amount of dollars go for I know we have $2 that go towards the fire service for EMT, et cetera. Do you know that dollar amount? Because I'm trying to see where all we could pull money from and what is it being used for, et cetera. For emergency services. Yeah. Do you guys have an amount for that?
Good afternoon, Senator. Director Stevens, Virgin Islands Emergency Medical Service. Ms. Sheila, do you have that number with you?
Good afternoon. Not presently. I can search through my...
Well, I'll go ahead with my questioning and you could pull that up and let me know while I continue on. What I'm trying to find out, for example, in the letter that the fire services were able to receive, it said you guys potentially might have been cut off by, I think it was August 1 or something like that. What I'm trying to find out, what happened after you received that letter? Did you reach out to whom? Because as a senator, I get a little bit, and I'm not talking to you directly, I get a little bit frustrated because things happen within the executive branch and we are blindsided last minute. And if we're in a situation where these bills were piling up and we didn't know anything about it, I don't feel happy when I have to pick up a newspaper to be told that this is what's happening in my community. I'm not happy when my constituents are calling because they're told that their last day of dialysis was yesterday, but it got canceled because of the storm. I'm not happy to have those types of conversations. So I need to find out when situations like this occur, who do you guys notify or who do you reach out to? Could somebody from fire services let me know quickly before I continue?
Your question to me, Senator, is kind of vague. Which question would you like for me to answer?
The one where you guys were notified that Pafford was ceasing staffing. What did you do after? Because I'm trying to figure out the trail as to how we even got here. Just you as an example.
So for the Virgin Islands Emergency Medical Service, we had an internal discussion. Personally, I thanked Pafford for their service and their commitment to us for the years that they've been here, and understood that since I did not have an existing contract with Pafford, I needed to find a way to exist without Pafford. And so that's what we've done.
And it seems like some of the agencies, could I just quickly wrap up? Some of the agencies were attempting to do that, like what we were hearing from the hospital, JFL, they were preparing for this. But it seems like, for example, at another location, you weren't hearing the same thing. And as a government, I would have assumed we'd have been a little bit more unified across the board to be prepared for this. Just the last question I want to ask, not to kill my time, well, it's gone. If Pafford is paid, are they willing to stay or they just want to be paid and go? That's what I need to know. Can anyone answer that?
That would be a question that actually should be asked in reference to Pafford, but this is what I would answer if I may. It's very costly to have Pafford here within a territory. I think that the transition plan, Department of Health actually been transitioning. The fire department has also attempted to transition. As I said before, the cost of health care has exorbitantly increased since our pandemic. And it's not just nationally, it's globally. Everyone's finding it very difficult to secure staffing, especially when you're asking them to transition from their homeland to come to the Virgin Islands to maintain the standard of living that they're accustomed with. So we are actually working with other agencies nationally to be able to bring staffing down as well. So whether or not staff Pafford would like to stay, The question is, can we afford
Can we
it?
afford them? And that is what I'm trying to get to. But I do appreciate your indulgence because that's important because as much as the people of the territory we hear, we haven't paid them, at some point, we have to learn to build within so we could stand on our own and not be dependent on outside companies that could potentially be putting our people's lives in danger if they can no longer provide us the service. Thank you very much, Mr. President, for the additional.
Thank you very much,
The testifiers, mainly from the OMB or any other entities. I just want the bottom line. Pafford has not been paid. Are we in any emergency crisis at the moment? Because I'm hearing about transitions. I'm hearing about us ultimately setting up our own situations. Are we in any emergency situation in any of the hospitals, agencies right now? Or is this something that we can tackle over the next couple of weeks? Or if something isn't done today, is something going to cave in? That's what I'm trying to understand.
If I may respond to that, according to what Pafford is saying to us, they too have their obligations, and if they're not given a certain amount of funding prior to a specific date, which really and truly was August 1st, they would already, because they also have to pay their employees not just here, but abroad as well. So that's really what the emergency is, and it stems to if we do not have individuals that are providing dialysis service, then those individuals are going to become sick in a very short period of time.
Okay, so just quick follow-up. So you're saying if Pafford gets paid, some of these individuals will stay on the job to make sure our dialysis patients are covered, or are they still leaving? Because that is what I'm trying to get clarity on the whole day.
What I'm saying is that despite the fact that they told us that it would leave on the 1st, and then they said Wednesday, I think it was Wednesday, it would be the 14th, they've actually stayed in play. So right now, our dialysis patient is being still served, despite the fact that we have not paid. But we run a risk of losing them, and they have been graceful enough to stay because they know what the critical nature will bring if the services are not provided.
Okay, thank you very much for that additional.
And particularly that's in the area of the CKC area with the dialysis.
Correct, sir.
Point of information, Senator.
Much. I just wanted to take this quick moment to really say I appreciate my colleagues this evening. We were able to come together unified and really put the people of this territory first. We recognize the issue occurred, and whether or not we were a little bit blindsided by it, this is what we do as our jobs, to really work on behalf of the people of this territory. And I would like to thank them because our dialysis patients need the help. Thank you so much, Mr. Chair.
Thank you very much, Senator Alma.